My name is Aloyce Urassa. I'm a Malaria Normal UK champion and also a youth leader for health through Results UK. I'm a student in Health Laboratory Sciences, Bachelor's of Science. I'm in second year now. I have a great interest in fighting against malaria.
So my name is James Austin. I am an entomologist. The last 12 years I've worked at BASF, and I am the Senior Global Development Manager. What's been your own experience with malaria? I'm sure that's kind of shaped your interest.
Malaria, I've known malaria since on my very young age when one of my brothers got malaria, and it was really a tough situation at the family as the mother had a lot of work. I came to learn more about malaria when I joined high school, where my friend got malaria, and it was really tiresome for him, and he even developed severe symptoms which were really devastating to us.
Do you think people in other countries know very much about malaria outside of your own country? Or I would guess in Africa perhaps, but what is your viewpoint on people's general knowledge about malaria and its impact on folks?
Perhaps, yes. I think that I've got an opportunity also to visit some other countries apart from Tanzania. I've been in Kenya, I've been in Rwanda, I've been in Nigeria, I've been in Ethiopia. And all I've been, I was working on health system, infectious diseases, TB, HIV, and malaria. And I got an opportunity to meet a lot of young people and some experts in these fields of malaria. And they had a lot of stories about malaria. So perhaps a lot of people knows about malaria and feels the impact of malaria. Being an entomologist, does it mean that you really like mosquitoes?
To be perfectly honest, while many focus on killing mosquitoes, my focus isn't necessarily on killing mosquitoes specifically as much as it is killing the etiological agents associated with the disease transmission of mosquitoes. So whether it's hemorrhagic fevers or in this case malaria, different kind of parasites, I think that that's a more realistic focus, because if we're so tuned in to only killing mosquitoes, they're going to find a way to usurp a lot of our efforts. And so that's why there's so much effort given in rotating chemistries and using alternative control strategies, because they find a way. So have you seen any impact? Have you had any impact with COVID on net distributions, for example? I'm sure you're quite keen on that as a person pursuing this line of research. Have you seen any impact of the COVID pandemic on net distributions in your country?
For Tanzania, I can say, relating last year, I can see last year over 6 million mosquito nets were distributed through primary schools to children to take to their homes, but was also being distributed in the hospitals for pregnant women or already after delivering. They are usually being given nets. But the impact of COVID-19, that means schools were closed, so those people doing the programs in primary schools could not proceed. Also, there are of people across some homes in some regions, so they had to stop the movements due to COVID-19.
The grave concern, of course, and the reason for my question is because we know that in light of, I would say, a lack of travel and the difficulties with shipments, that the possibility of reductions in the numbers of nets that are given to different communities has the unfortunate possibility of a resurgence of malaria that would be highly undesired. And there's projections, of course, that it might return to some levels from years ago, which we've made such good advances. We don't want to see the loss of progress in regards to having a good opportunity to mitigate the disease transmission through the distribution of nets. So, I'm hopeful that the impact won't be so great. I'm just wondering how can young people in Africa be involved to get in the fight against malaria? Especially during a time like this with the COVID pandemic, what can young people do in Africa to be more engaged to pursue a noble effort to beat malaria?
Yeah, about involvement of young people. As a young leader for health, I've also been advocating a lot for engagement of young people in these programs, fighting against diseases like malaria, but also ensuring health system strengthening. But what can be, before I say what can young people do, I should say what can be done for young people to engage or to get more into this fight against malaria. First of all, they need more mentorship and trainings for them to acquaint with these issues of malaria and health systems. But also they need more space for them to be engaged. They also need motivation. They need support. So what young people have to do is to take these opportunities and make a serious impact out of them. Young people have to reach their communities to raise awareness. Young people have to reach the leaders to raise, to ensure that there's political will for fight against malaria. Young people have a lot to carry to ensure that health systems are stronger. But young people have to be the real advocates and the real awareness campaigners for people to be consulting or taking the right measures against malaria. Because young people have the great voice. They don't just need a voice. They really need to utilize the power that is within them. I believe that we all have that power and we all have that reason to make it. But what it is needed is for us to unleash that potential within us and ensure that we are making a difference. So also young people need to cooperate because solidarity is very important. They need to come together. They need to reason together. They need to formulate a manifesto that will discuss their issues in depth. And they need to take that manifesto to people who can really support them.
Yes, I couldn't agree more. I mean, you are the future, not just for your country or countries, but you are the future. I think that's an area to really work on. But most importantly, young people like yourself are a weapon into themselves because your ability to share, to experience, to educate are going to be key.
Okay, what I'm saying, COVID-19 has really affected a lot of fights in and promotions of health systems. COVID-19 has affected a lot of campaigns against diseases like malaria, and there is a great need for the fight to be, for the more strategies to be set against, to ensure that the fight goes on. Because malaria, as the WHO predicted, that it might double due to the impacts of COVID-19. So the countries and the global organizations have to take more attention to these diseases because even the symptoms of malaria mimic some symptoms of COVID-19. So my going to go to the hospitals and end up taking local medicines or trying to take precautions like it's COVID-19 are going to happen, but we are going to miss the statistics. We are going to miss the data because confusions might happen in some places. So what I think is that healthcare workers should be more attentive in identifying malaria cases, but community health workers also in the local areas should even increase the efforts in identifying and educating the community to visit hospitals and test for malaria. So we should emphasize on more testing for malaria to confirm that this is malaria and not COVID-19. But also politicians or those who are making policies, they should review the policies and ensure that the policies are really relevant to the current situation, because the situation is different from when we are setting the policies. We prepared the policies when there was no pandemic. Probably preparedness and preventive measures of malaria in the midst of COVID-19 or in the midst of pandemics was not included in the policies. So there is a great need to review the policies and put better strategies to fight against malaria and other diseases as well.
Do you think that in light of some of the learnings that your country or other countries nearby are perhaps even now adjusting in this current pandemic, are applicable to how we perhaps pursue malaria education and or opportunities to control malaria?
Yeah, I can say a lot of lessons are to be drawn out of this pandemic, like what the WHO director is trying to emphasize: solidarity, solidarity. What I'm seeing in many countries, some leaders have lost that sense of cooperation with one another. So if we're not going to cooperate, then we are not going to learn well from this situation. So the leaders have to sit together and discuss the impacts of COVID-19 in other diseases like malaria, and ensure that they are going to set strategies and implement them to ensure that they are beating malaria. So recently, there is no a pleasing response yet. We need more. They need to vocalize, they need to strengthen their interventions for malaria in the midst of COVID-19 and not do it normal. We cannot continue with the normal situations while we are in an abnormal or a new normal. So we must set strategies which align with the new normal. What do you see like the future of malaria in maybe 10 years to come or even more?
That's a great question, Aloyce. I personally believe that historically looking back at solutions that have been afforded, we've kind of focused them to things that we know. In many cases, in the development of insecticides, quite often it's only after these were insecticides developed for the use on crops that they then would be subsequently used in public health.
Oh, that's great. I wish that it becomes the reality for the whole world, not only in some countries, but not only in Africa, but the whole world. We really need a world free from malaria. And we believe that zero malaria starts with scientists, zero malaria starts with the community, zero malaria starts with the youth leaders, zero malaria starts with the national and global leaders. So zero malaria starts with everyone.